I think the Oxford AHSC will make a huge difference in a number of different ways, and I know this from my previous experience working in an AHSC in South London. In the first instance, I think it will catalyse the relationship between the four partners, and we've seen that already through the application process, how we've come together, brought our different perspectives to bear and created a really exciting bid which addresses not just matters that are important for the local healthcare system but matters which are important for the future of healthcare internationally. We know that that has excited people in our own organisations, and I think what will happen over the course of the 5 years of the licence is we will be able to bring that sense of mission and vision to bear with all of the clinicians who are working and training in our institutions so that they can really feel a part of it. They can begin to learn more about what's going on in some of the other organisations that they're working with on a daily basis. They can see what their contribution to that might be, and the product of it will be as bringing the very best healthcare to the people that we serve. It's very important that we're able to communicate some of the things that are going on. I think actually our bid is a really great read, and I hope that we can get that to all of the thousands of people that work across the four organisations so that they can see that and that they can find out about the work that the HSC is doing to pull that together. It's also really important, I think, for the local economy, particularly our relationship with the Oxford Academic Health Sciences Network will bring together what we're doing here with a whole range of companies that are involved in new pharmaceuticals, new devices, new IT, better ways of involving patients and carers more and more in managing their own care that will bring that innovation to bear, and so that the patients and the carers and the local population themselves will begin to understand and be really proud of what's going on here in Oxford, which is making a difference for healthcare internationally. I think we will need to make sure that we feed back regularly to all of the people involved in our organisations what progress has been made, what's been achieved across the six themes, and that we take the opportunity to get people's ideas about where that might go in future. It's a bit like the classic about NASA that the cleaner knows that he's playing his part in putting a man on the moon. If we get to the point where anybody that you encounter at a reception desk across all of our services knows that they're part of the Oxford AHSC and they know the way in which that's tackling the major global healthcare challenges, then we'll really have cracked it.